time. It's a pleasure to talk to you, and it's truly inspiring listening to your comments and your speech. So I want to pick up from there. And in your speech, you mentioned about innovation in action. You gave several examples for that, especially deployment of technology, changing the healthcare process. And you ended talking about the structures in place. So I want to pick up around that. And let me start by asking you to think about, on reflection, when you think about such a successful response that Australia had as a country, it's often a combination of preparedness combined with the right decision at the start of the emergency. Clearly, you made a lot of very good decisions that are now seen as world-class. But what policies and strategic decisions were in place that allowed Australia to fare so well compared to similarly placed countries? And I'm particularly kind of reference to your August 2019 National Health Plan, which we'll talk a little bit further about.
Look, firstly, thanks to Dr. Khan, to Deborah Wynne-Smith, to Charles Kiefel, who's really driven this conference. And I'm sorry, Charles, that circumstances are such that we can't all be meeting together, but you've been very much the progenitor of the conference, along with Deborah, to Jane Wilson and Larry Marshall, our Australian co-chairs. So to everybody, thank you. So to go directly, Dr. Khan, to your point, it's exactly what you've set out. We had a combination of preparation and then decision-making. The preparation is that Australia had long had pandemic preparedness, as had many other countries. I think the World Health Organization in 2017 and 2018 reviewed, and it determined that Australia was as well prepared as any country for the pandemic, and I think their observation was right. What set it out was we had a national incident centre, which is actually deeply integrated in government. So it's within the Department of Health, but it's designed as a physical and technologically linked hub right across government and vertically within. And so we had the National Medical Stockpile, which, as you can imagine, has masks, it has medicines, has equipment, but it's also a process. So it's able to source immediately because you never know what the shortages are going to be. Secondly, you had the coordinating mechanism of the National Medical Centre, the National Incident Centre. And thirdly, you had the coordinating mechanism of the National Trauma Centre, where we have our SEALs or Special Air Service of the medical world, our AUSMAT, or Australian Medical Assistance Team, that can be rapidly deployed. All of those pre-existed and all of those were then implemented. At the same time, the Chief Medical Officer of Australia and myself were integrated into a subcommittee of Cabinet, which was the principal decision-making body, and that's the National Security Committee. And so that National Security Committee, which normally comprises the Prime Minister and our Treasurer, our equivalent of the Secretary of Treasury and the Finance Minister, but also the Defence, Home Affairs, Attorney General ministers in Australia. They brought the health in, became a rapid decision-making body, but in a contestable environment with the Prime Minister chairing it. So he owned the process, but we had in place those existing platforms. And so we were able to make informed, rapid, real-time decisions, but in a contestable environment, and then focus on implementation.
Thank you. So really an integrated, system-wide innovation capacity, if I may paraphrase. Yes. So, I read through your long-term national health plan, and you lay out the 4 pillars very effectively. Then you talk about the plan for aging well and aging care. Broader than just COVID, how does innovation fit into this framework? So 2 parts to this question. And then secondly, now that we've had the COVID experience, what would you do different or emphasize more or less of with hindsight of what we've learned?
Sure. So in terms of COVID, and generally, innovation and healthcare are inextricably linked. The story of the last 200 years of medicine is of accelerating innovation, which is leading to accelerating outcomes. If you think of a world which has gone, in the Australian example, from 50 years life expectancy in the late 1800s to mid-80s for a child born today, you see the fastest growth in life expectancy in human history over the course of just beyond a century. And that's been directly linked to medical research, medical innovation. It's innovation and competition and exchange of ideas. So this combination of cooperative competition where ideas have been exchanged, which drives it. And so our goal now through this long-term national health plan is to foster that. Australia, for example, has a hybrid health system, not anywhere near as nationalised as the UK model, which of course is not a perfectly nationalised model, nor anywhere near as privatised as the US model, which of course is not a perfectly privatised model. It's a hybrid model in Australia of the public and private, and we guard that generally. We just had an uptick in private health insurance in Australia in the figures released yesterday. So all of that's the background. So the innovation is fundamental. Secondly, in terms of what we do and what we've done during the course of the pandemic, I think we had very strong cooperation with the states. If anything, it would have been moving even faster on that front. The Prime Minister created a national cabinet. So we have the National Security Committee, which is the Australian government, which is a subcommittee of the National Cabinet. That's, effectively, as the name stands and is understood all around the world. But the National Cabinet became a transformative body. I think it's not dissimilar to your Council of Governors and the relationship with the President, but this became a second decision-making body to coordinate the work of the states and territories. And it was we obviously had a structure in place, but it ditched, for all intents and purposes, the intermediate bureaucratic levels and steps, and became state and national leaders together making decisions in real time. And so if we thought of that a year ago, that would have made it even faster and even easier. But the crisis actually enabled the transformation, not just in technology, but enabled the transformation in governance.
Thank you. If you were now, one of the challenges we're all facing around the world in developed countries, in part related to this population aging and the health demands. There are two facets to that. One is you call out aging well, which is, it isn't just about life extension, if I was to read it, something that my company and I'm very interested in, but how to expand the healthy part of life. In other words, we live longer, but live healthier. And so require less intervention as a medical term. So you've called that out, and it'd be very interesting to see what examples, what do you think about when you tell Australians of the national policy around aging well?
Yeah, so it really, our principles on aging well are firstly to make sure that there's whole life care, but the best care of all is preventive. So there's a lot of work that's being done on preventive health older Australians. What does it mean? There's both the physical and the mental health. One of the great crushing impacts is from loneliness and isolation. If there's a thing as a society and as a country, as well as a governance system we need to improve, it's building those connections for the isolated or lonely older citizens. And very easy, where somebody is maybe widowed, divorced, single, Their life circumstances are such that they're living alone. They may not be in the same city as family. They may not have family. And they are really at a double risk because incidents can happen, but much more, there can be deterioration without support. So to build those networks will be incredibly important. That's a key part of what we're doing. Secondly, there's the physical support, and that we're really looking at building that from age 45 and 50 onwards. So as to give people that sense of custodianship of their health, but with support. And then the third element is transforming the actual aged care system. And so we have a what's called a Royal Commission, which is the highest level of external review a government can have into our national aged care system. And the early directions are creating one single aged care system where you have low-level in-home care as an option, higher-level in-home care as an option, and then care in a residential facility as an option, but as one integrated system. So really simplifying that, the bureaucracy around it, the complexity. If you're an older person, it's just going to be too hard for many to navigate without family to support them. So to simplify it and then to integrate that care. Those are the big early directions from the Royal Commission, and they're certainly the things which we were hoping they might come up with and which we support.
It's interesting that you mention about the loneliness that modern society and the breakup of community networks has happened. Some researchers have estimated, at least in the US, maybe up to a third of premature deaths actually may be related to loneliness in the broadest sense. So you're calling that out. And that leads me to the use of technology. Obviously this meeting would have occurred live, but we're using technology to have this conversation across the world. But you very astutely mentioned in your comments, in your speech, that decades-long plan to deploy technology was implemented in weeks, if not months. So it raises a question for me as a medical scientist, as a physician. I know we're conservative as a profession, but where was the bottleneck? What is it that's preventing us using existing technologies to transform the quality of care and reach that only resulted because of a crisis? As we look to the future, what else is sitting on the shelf that we're not doing? And to you as a policymaker, as a leader, what can be done to unlock that bottleneck?
So there've probably been two great learnings for me during the course of this year. One relates to the partnership with the population and the ability to bring forward reform. The partnership with the population is that in terms of things that you would have expected that might otherwise have fallen by the wayside, blood donations, vaccination rates, they've continued because the population was actually very focused on their health as well as contributing to the COVID response. So the Australian population has been fantastic in building that partnership with the premiers and others. The second thing is that we have been able to bring forward reform far more quickly. I mentioned the governance and some of the other reforms, but telehealth is probably the signature reform. We're video conferencing and otherwise, but this has actually become now a standard platform for our operations. And so there was a cultural change, but also a bureaucratic change. Bureaucracies are slow, and I planned a 10-year migration to allow telehealth to be a standard feature. But in the time of approaching lockdown, we had to keep the doctors and nurses safe because we saw examples overseas, whether it was New York or Italy or Spain, where there was just, a catastrophic health outcome for the medical professionals being exposed, as well as to keep our elderly and patients safe. And so we took that platform that we'd been developing and we literally rolled the dice and implemented it. And our Australian Health Department was magisterial in the speed with which they implemented it, and we were able to iterate. We said, well, okay, we recognise there's a change needed here. We need to adjust this telehealth item or platform, and we took the public with us. And I learned that we could make that change. So we had a plan, but we just ditched that plan and adopted overnight because the technology platform had been built. So what's the key learning? We can do things much more quickly, subject to safety. You know, drug discovery and development, well, that's a different matter. We always want to be safe. But as you've seen with the vaccines, you know, this is your space. The world has never had an mRNA vaccine. The world has never had a coronavirus vaccine. So one by platform, one by subject matter. And we've been able to do that. And it's pretty clear now that we will have, I think, safe and effective vaccines with the effectiveness to be the variable. So the answer is, given a task, humanity is immensely flexible. And we just have to give ourselves the task and set those rapid stretch goals. And sometimes, you know, what you would call urgent, short-term, rapid needs can necessitate and deliver the most extraordinary innovation.
Well, thank you. Being a CEO of a biotech company, I've had a wonderful experience in Australia. In fact, one of our global labs is headquartered at University of New South Wales. I'm not impartial to any one particular Australian university, but we have my bias. That's where our company does a lot of our research. Thinking about the country, what is it about your policies, your ecosystem, that encourages this public-private partnership from your perspective? I have my experience as biased, but what is it and how is that accelerated?
I think there are probably two things. We're practical rather than ideological as a country, and where we drift into the ideology side of it, whether it's left or right, then I think that's when there's a risk. And very innovative and creative. You know, part of being an island nation over, you know, some hundreds of years since European settlement, and then with the magnificent indigenous heritage before that, is of being relatively self-reliant and therefore, you know, creative. And that tradition hasn't been lost. And our task is to maintain and actually foster that tradition.
Thank you. I know we're coming to the end of, I think from my perspective, we continue for at least another hour exploring into some of those details. I want to thank Deborah, Chad Holliday, the whole team that's helped put this together. But most importantly, Minister Hunt, thank you for your time. Thank you for sharing your experience and your perspectives. And hopefully on another occasion, I actually look forward to meeting you in person. It truly has been a pleasure.
I'd love to catch up with everybody, and thank you all for staying with this. It's a different world, but it's still the same world where innovation, engagement, people-to-people contacts, ultimately these create things, and it's that innovation which makes the difference. So thank you and take care.
All right. Stay safe. Take care. Back to our team managing the meeting. Thank you very much.